Welcome to another Superior Health Wednesday. These regular conversations that we have with Jim LaJoy, Executive Director with Superior Health Foundation, where we talk about some of the nonprofits, organizations, and causes that Superior Health Foundation helps fund, which are all health centered and they focus on a lot of different topics. And today we've got a special guest with us. Greg, if you want to introduce yourself for folks, I mean, a lot of people know you, but if you want to give us an introduction of who you are and who you work with.
Yes, well, thank you, Ben. Greg Toutant, CEO for Great Lakes Recovery Centers, and we're a behavioral health services organization stretching from one end of the Upper Peninsula to the other.
And the reason we're all on this call today, kind of talking about something that's coming up, and it's a significant, really significant amount of funding that's coming into the area that took a lot of collaboration and a lot of work together, and it's going to be spread across the Upper Peninsula, and that's going to be announced during the spring grant celebration, if I'm correct.
Yes.
So you want to start with kind of talking us through the collaboration part of it. Who are we working with to
Sure.
to get this funding?
Sure, happy to. So let me just kind of give like a brief overview of how we got to this point. So about two and a half years ago, the Superior Health Foundation became part of what is called the MOP. It's a Michigan opioid partnership that looked at ways that we can address the opioid addiction issues all across the state of Michigan. And we were thankful in that we were asked to join this. It's a statewide initiative that involves the Blue Cross Blue Shield, the Michigan Foundation, Blue Cross Blue Shield, the Michigan Health Endowment Fund. And, we're the only UP funder that was part of this, which was kind of neat. And they were committed to providing some funding to the Upper Peninsula. So as part one of this funding, we provided some funding for addressing addiction issues and treatment. But the second part of this whole project was really to go one step further and address the recovery community part of it, which includes housing and back to work and on the job opportunities for those who are in recovery. So we pooled our resources together, and we're going to be happy to award $490,000 at the May spring grant celebration. And one of the recipients for that is Great Lakes Recovery. They're going to be receiving $150,000 for the project. So we've had a great relationship with Great Lakes Recovery. They're tremendously good stewards of the grant funding that we have awarded them in the past. We like working with them, and thought it'd be good for Greg to come on today to talk a little bit about the funding that he's going to be getting and the projects that he's going to be addressing with Great Lakes Recovery for the recovery communities.
Well, and that's a perfect segue into that. So if you would kind of talk us through what is it you're already doing and how will this funding better support your mission?
You bet. No, thank you. And we certainly are very profoundly grateful to the Superior Health Foundation and the other funding partners in really addressing some of the underfunded or gap areas that are critical to maintaining people in the community. So after someone leaves a treatment experience, oftentimes what we find is they're in a rebuilding phase of just about every facet of their life. And so as we help to usher people through the process of recovery back in their home community, we know that there's going to be potentially housing instability or employment instability or social support instability. And what we want to be able to do with this funding is to come alongside of the clients in a way that supports them with linkages and assistance with employment and housing and social supports. Because if we don't address those issues, the chances are recovery is going to be less successful and meaningful. There'll be more triggers for relapse, more increased stress, potentially more toxic environments. So we know the items that, very daunting items that people face on their way back, trying to rebuild their lives after having battled some significant addiction and mental health issues. So our program, we entitled this Rebuilding Lives After Addiction. And it really is a community-based recovery program in which our core case managers work with a collection of clients that are willing to get this enhanced care, where we network with very friendly employers that are willing also to extend their hand to people, knowing that they're working their way back in life. So we can take away some of those stressors for both the employer and the client, as well as making sure if they need assistance with job placement, with resume development, with general on-the-job support, that they have a friendly face and connection and peer that they can work to that can enhance that re-emergence back into the community. And we also look at the other facets of a person's life, because that may need stability as well, not just employment, but housing. If you don't have a safe and affordable place to live, your chances of maintaining sobriety, especially in those early days, it's critical. So housing plays an important role, as well as ongoing linkages to aftercare, healthcare, and then social supports. So those are some of the facets of programming that we want to wrap around a client to really enhance their community integration.
And Greg, if I could just step in here 1 second, Ben, and just do a follow-up question relative to that. When you talk about the, interview skills and resume building, what you're really doing is investing in your clientele, not only those in recovery, but the families. Can you just share a little bit about how important that investment and believing in them and providing them those support systems does for their recovery, in this entire process?
It's a good point to reflect on, because the recovery journey is a long-term process. It's not just an episode of care in outpatient or an episode of care in residential. But if we're going to make that endeavor more successful and rewarding for a client, then we have to stay involved with them. If we want to have community integration really work, then we have to walk with them for a longer period of time, often than managed care or insurance really allows. And so critical funding like this really helps to ensure that people can be maintained in a healthy environment in the community, and that they have familiar providers and faces and relationships that can be maintained, not just a constant starting over. And so what we find is that long-term relationship is such a key factor to ongoing success.
And putting these systems in place, having this long-term plan, because these aren't just, you call them clients and they are clients, but these are our neighbors too. These are people that we want around us. We want them to stay alive. We want them to stay as a vibrant part of our community. They just have whatever their situation is. It's just more visible than other people. So you're creating those situations where they can get back to being more successful, more involved in these things. And I think it's just, if you could kind of talk about what have you seen as some of these successes from people that have gone through this and benefited from what it is that you do.
What we see often are those long-term benefits where clients do come back to us and not only say, thank you for walking with me on this journey, but the fact is they can make substantial changes in efforts to maybe reclaim their families, get their children back, have the longest term, maybe meaningful employment that they've had in many years. And oftentimes the self-efficacy of how they feel about themselves in the community is enhanced, where they're giving back finally, and they feel rewarded. So we hear a lot of success stories, but we also know there's a lot of tragic endings and a lot of additional hardships that people encounter with relapse. And so that's why this longer term relational approach of keeping connected with clients is critical, because we know relapse is a part of the addiction disease. And so if we can lessen the burden and the effects of relapse so that there are less people going back to the emergency department or having difficulties with law enforcement or acute chronic medical conditions, then they're going to be able to experience a greater integration with the community, and it helps to improve the vitality of the community itself. So when we see all those stressors that are lessened because of this, then we know that we're making a positive difference. And like you said, it does touch every facet of community life. It can be your brothers and your sisters, your children, could be your grandparents. There's not an age factor or demographic that isn't involved at some level with the disease of addiction. So I think the ability for this 2-year pilot funding will give us a model of how we have a total case management approach to clients in the community.
And one of the things maybe you both could talk about, like by doing this, we're announcing this, the grant funding, you're doing it during a celebration. And one of the things this does, with you two working together and doing this in such a public way, is it's still working to erase those stigmas of what does addiction look like, what resources are available. It's okay to talk about these things. In fact, it's more invited, so that when people find themselves in addiction, that there's not as much shame involved with it, that they feel more likely to reach out for help. So if both of you kind of want to talk about why it's so important to do what it is you do in such a public manner.
Well, I can address that first, and you're absolutely right. I mean, there's stigmas with mental illness, there's stigmas with substance use issues, and what we're really hoping that will come out of this are some real success stories and people being able to share their stories about how meaningful this was, to have a roof over your head and to have a support system in place where you're getting a job, a meaningful job to go to each day. That is so vitally important to this whole process. And as we see this through, we see this as just the building blocks of something even bigger. Just last week, we had a conference call with the Michigan Opioid Partnership talking about next steps, because this isn't going to be the end. We've agreed that this is so important that we want to be able to put some additional funding into this, and hopefully with those success stories and those back to work ideals that come out of this, it will provide, the stepping stones to sustainability, as Greg alluded to.
Yep, absolutely. And really the what we want to be able to promote in terms of tackling ongoing stigma is this is an investment in humanity.
Yes.
And it's going to have a critical return on that investment. And if we really we're energizing the mission with this funding, in the sense that there's no one that's not impacted at some level by addiction, even though it's slightly easier to talk about it now publicly, there's still stigma that's out there. And oftentimes that stigma is just rooted in fear. So we're trying to take the fear away of working with people that have had certain crises in their life and some certain downturns, and really trying to focus that lens back on doing the right thing in terms of helping people in need.
Well, and certainly as you get through this, more people are hopefully going to want to be either involved directly with this or will want to support what you're doing. How can the general public support this initiative?
And thank you. The easiest way would be to contact our Rebuilding Lives After Addiction manager. And that number is, of course, area code 906-458-4317. And you can also jump onto our website at glrc.org. It will have information about program eligibility and services. So by all means, you can reach out via the web or a phone call, and be happy to help navigate folks.
Is there anything I've missed today? Anything leading up to the spring grant celebration we want to talk about, or just any final thoughts for today?
Well, the one thing that I'd like to mention, and then I already alluded to it, but the real win that for us and other organizations is, we used to operate in isolation on these issues for so many years. And what's really good to see now is this wholehearted, spirited collaboration among a series of funding partners that are like-minded, that are looking for solutions to very, very complex problems. And for us, and we've talked about this before, Ben, in previous segments, this is a jewel. It is so wonderful to be able to work with so many funding partners that have an investment in the Upper Peninsula of Michigan. And for many years, the Upper Peninsula was kind of left off that map when it came to collaboration. Well, we've established that. And I think this is going to lay the groundwork for some pretty amazing opportunities going forward. And that's pretty exciting to be a part of.
It really is, and it's great to see more people, not just within our community, but you bringing that attention from outside the area, so that people are invested in what we're doing and our people that are there, so that we literally don't get left off the map. That happens more often than we care to admit.
Yep.
But it's a great next step, building on things that already exist.
Absolutely.
And I tell you what, Ben, we already had one example just this morning when we think about people coming together. And Jim alluded to the fact that funders are coming together, service providers, but also community members. We had a private business step up to say, we really want to come alongside of this program, and we want to give free haircuts to the folks that are out there that'll be re-entering the workforce, and give them a spruce up and get them ready for re-entry for work. And they didn't have to. They just said, we saw this, we connected with this, we know there's a problem out there. We want to do our part to help. And that's just one small ripple of the unintended benefits of promoting programs and breaking through that stigma.
And I was just going to say, that's a perfect example of what we talked about earlier about community involvement, and really rallying together for the better good of humanity. And when you have businesses that do things like that, that's awesome. That is a really good, heartwarming story.
Yeah. And that's the kind of thing that people will see that and hopefully want to imitate and improve upon that as well. I don't know if we want to, if you have the name of the salon handy and you want to give them a little credit for calling in, or you want to do that at a later date.
You know what? And I think I have the right name here. It's the Good Barber Lounge, and I believe that's the proper name. And so we want to give them a shout out and a bump. So yeah. Kudos to them.
And that's a place that you frequent often, right, Greg?
Yes, they've saved some money on me over the years, so that's all right. I go in for more of a buffing than anything.
Well, we'll certainly follow up with them there as well as they move forward with that, to put a highlight on people who are doing good work in our community, because it's important to celebrate that and show that people are making a difference. So that's encouraging.
Awesome.
Right. All right. If there's anything else, last thoughts, otherwise we'll let you two go for today.
Thank you very much. We appreciate it, Ben.
Yeah, thank you both.
Yeah,
and,
thank you, Ben.
Yeah, I'll talk to you soon. Have a great day.